Okay, hello everyone, and thank you so much for joining us. My name is Kat Nicholls, and I am a content creator here at Happiful, and I'm joined today by therapist and mindfulness teacher Natalie Englander, and we're going to be talking about the differences between self-help and professional help, and how we can decide what it is we need. So to start with, Natalie, can you tell us a little bit more about yourself and the work that you do?
Yes, so I'm a CBT therapist and a mindfulness teacher, and I've been practicing for over 10 years now. And I work in the NHS and in private practice. So in the NHS, I work as deputy clinical lead for a mental health service. And then I also have my private practice where I see clients for therapy, and I also run an 8-week mindfulness course. And generally, most of the clients I see in my private practice are usually millennial women who are experiencing perfectionism and low self-esteem.
Oh, interesting. Perfect.
Yeah.
Thank you. So to start this conversation off about self-help and professional help, it'd be great to hear a bit more about your opinions about what the differences are really between those two things, between getting the self-help and working with a professional.
Yeah, absolutely. I guess self-help might involve reading a self-help book or maybe completing an online self-help program. And I guess the main thing is that you'd be working on the problem on your own, yourself, without the assistance of someone else. So you're sort of relying on yourself to read the book, to understand it, and to try and then put some of it into practice if you're wanting to make some changes in your life. And I guess, given that it is a book or an online program, self-help is therefore also generic, in that it wouldn't be tailored to you as an individual. But sometimes people can actually find that really reassuring, picking up a self-help book and reading it and thinking, this sounds exactly like me. Even though it wasn't written for me, but actually I find that really reassuring to know, I guess I'm not the only one who struggles with this particular problem. Whereas I guess professional support, like seeing a therapist or having therapy, would be different in that it would be very much tailored to suit your needs. And it would usually involve meeting with the therapist, I guess, on a weekly basis, usually for an hour, to talk about your problems. So you'd very much have support from another person to reach your goals, and perhaps a bit more accountability as well. You know, someone who's going to keep asking you each week, oh, how did you get on with that thing we said that you were going to try this week? And I guess I was, thinking about the sort of the main differences that would stand out for me, is that professional help, therapy, sort of allows you to be able to share your thoughts and feelings with someone, which you wouldn't necessarily be able to do reading a self-help book. And that in itself can be so therapeutic, just being heard, having someone listen to you to sort of validate how you're feeling, which unfortunately a book sort of can't validate you in that same way. But a book is cheaper than therapy. So that's one difference I thought of, which I guess, is really important for the majority of people, something that is very much sort of a factor in people's decisions. And I think the other main difference that stood out for me is that if our emotions get heightened whilst we're learning about ourselves or our problems and we're working on things and we face challenges, if we're having professional help, having therapy, then we've got someone there to help us work through those feelings. Whereas if we're reading a book and we sort of feel a bit triggered, we may be a bit more on our own in terms of managing that, and sort of navigating through it, I guess.
Yeah, absolutely. That's a really good point. And it's really interesting to hear kind of some of the pros and cons. And of course, different things are going to work for different people. So I suppose I'm curious, what would you say to someone who maybe is unsure about which path to go down to figure out which might be right for them?
Yeah, well, I mean, I think exactly as you said, it probably really depends on the person, and their preferences. So if there's someone who doesn't believe in self-help, then I'm sure professional help is going to be more useful, and vice versa. If someone doesn't like the idea of therapy and sort of sharing their problems with another person, then self-help will probably be a great place to start. And I think what's quite important is it also depends on your ability to be able to sort of motivate yourself, I guess, because there isn't going to be anyone there sort of cheering you on if you're reading a self-help book. So it depends if you're able to kind of take action yourself without that support. It is the motivation there, essentially. And I guess if I'm sort of putting myself in that situation, imagining I was discussing it with someone and helping them decide and figure out self-help or professional help, I would definitely be thinking with them about the severity of their problem, and also the impact that their problems are having on their functioning, and sort of, you know, being able to live their life day to day, go about their business as usual. So if things are pretty good, but maybe someone's got mild anxiety, but it's not stopping them from living their life too much, then maybe self-help is a great place to start. But if someone's really struggling with anxiety, and they've sort of stopped going to work, they're not really going out anymore, then maybe professional help would be better. So definitely the severity and the impact, and also the onset, when your problems started. So if they're more recent, probably going to be more susceptible to self-help. Whereas if, let's say, we're thinking about depression, if you've been depressed for 5-10 years, then again, I'd probably think professional help might be better. Maybe a self-help book might not be enough in sort of getting you through out the other side.
Yeah, that's really, really helpful.
Yeah. So yeah, I think sort of a lot for someone to think about and weigh up, but hopefully those are a few key points that someone could think of to help them make the decision.
Yeah, definitely. So as you said, to kind of summarize those, it seems like checking in with your personal tendencies, whether or not you're self-motivated or whether or not you think you would benefit from having someone to support you with that, kind of thinking about the severity and the impact of it and how much it's affecting your life, and the onset of it, if it's something that's quite recent or if it's a long-term issue that you've been struggling with that potentially could do with professional support. So yeah, those are really helpful points, I think, for people to think about. And if someone has thought about those things and has decided that self-help is the route they want to go down to, what would you recommend they start with? We know we've mentioned books and kind of online courses, but yeah, where would you suggest people start if they're looking down the self-help route?
Yes. So yeah, I mean, definitely books is probably the main one that we think of when we think self-help. And there are thousands of self-help books out there, sort of lots of different types. Some of them are maybe more kind of inspirational bestsellers, maybe by someone who's sort of gone through those challenges. And then there are ones that are more sort of mental health focused self-help books, usually written by therapists or kind of professionals, psychologists, etc. But I guess there also are other types of self-help, even more nowadays, with things like booklets, online programs, websites, but also I think people are using things like podcasts, blogs, even, you know, therapists on Instagram, to sort of act in some ways as a form of self-help, where they can learn and understand more about their problems and pick up some kind of tips and tricks and things to try out. But if people are wanting to go down the self-help route, then there is a huge resource of book recommendations on the Reading Well books on prescription website, and these books are all recommended by the NHS, and so it's kind of endorsed by NHS health professionals and people living with those particular problems as well, and you can get them all free from your local library, or I guess order them on Amazon. Usually most of them aren't more than £10. And I know that myself and lots of therapists often recommend that, and particularly there are books that are part of the Overcoming series. So there's Overcoming Perfectionism, Overcoming Social Anxiety, Overcoming Depression. There's like I think nearly 30 of them, overcoming everything and anything probably that you can think of, and they are really, really good. And most of them are all CBT, cognitive behavioral therapy based self-help books, and I mean they're great for therapists themselves, as sort of a reminder or a refresher on the problem and what sorts of things you might look at if someone's having therapy, but definitely great self-help books for people struggling with different problems. And I think if you wanted those specifically, there's overcoming.co.uk has got them all there. And I guess what's nice about it is, you might type in depression on Amazon, let's get a good self-help book, but do you know if it's good or not? Do you know if what they're sort of suggesting is kind of legit or good advice? So I think if you stick with the reading well books or the overcoming books, then you kind of know that they're going to be good. There's not going to be anything in there that they're suggesting for you that's really unhelpful or dangerous even.
Yeah, because that is the risk, isn't it, with self-help, is you're not always 100% sure where it's coming from. So yeah, that idea of going to a slightly vetted list. Am I right in thinking NHS also have a list of apps that can be really helpful as well?
Yeah, they do. I think even if you just Google NHS self-help apps, it will again give you a list of all their endorsed ones. And there are quite a few different ones. I know there's lots of ones on sleep, for example. So yeah, definitely checking those out is a good idea. And then I guess within the NHS as well, there are IUP services. That's the service that I work in, which stands for Improving Access to Psychological Therapies. And that's a place where people can access cognitive behavioural therapy, but also self-help. So often it's guided self-help, where you're working through your own online program or your own booklet, but it's with a psychological wellbeing practitioner who you maybe meet with on a fortnightly basis for half an hour to check in how you're getting on with your booklet, how's the self-help going. Or it might also just be pure self-help, where you'll sort of have your initial assessment, usually on the telephone, and then they say, yeah, we've got this good self-help program for you, we can sort of activate it for you, and then you can go off and do it on your own. So you can access your local IUP service. Again, just type it in on Google, IUPs and where you live, or get your GP to refer you if you don't want to refer yourself. That's also a good option.
That's so helpful. And I like that kind of in between. It's almost in between self-help and professional help, isn't it? Kind of having a bit of guidance and support along the way.
Yeah, absolutely. I think it's a really good kind of middle ground. Or if you're thinking of therapy but you're not quite sure, that's probably a nice place to just sort of dip your toe in and see what it's like, I guess.
Amazing, thank you. And if somebody has thought, okay, professional help is the route for me, where would you recommend they start? Because again, there's lots of different options for people. So yeah, what would you recommend?
Yeah, good question, because I really feel for people who decide, right, okay, I want to see a therapist. Where do I even begin? How do I find them? What type of therapist? What type of therapy? Again, is this person, are the qualifications the ones that they're meant to have? It can be a huge, overwhelming minefield, especially if you're struggling with your mental health at the same time as well. So, I mean, I guess Google is usually the first place where people go. You could type in CBT therapist, St Albans, which is where I'm based, for example, and you'll get some people's websites come up. You can have a look that way. Or of course, you can use directories like the counselling directory, and they're brilliant because you can sort of search by either different therapy modalities or by particular problems or age, gender, etc. So that's a really nice way, because it then filters down and then gives you a list of therapists that okay, these are all the ones offering the type of therapy that I want, and they specialize in my particular problem. And I think that would probably be my main tip, is to try and find a therapist that specializes in your problem. So I, for example, can work with lots of different problems, but I specialize in working with perfectionism and low self-esteem. And someone could come to me wanting to work on PTSD, for example, and I absolutely could help them with that. But it would probably be better for them to see the therapist who, that's their niche, that's all they do, that's their bread and butter, because I think you'll probably get a better experience. So I think kind of not being afraid to be fussy of who you pick, and asking before you start working with a therapist if you can have an intro call with them. Most therapists offer this. So I, for example, offer a free 15-minute intro telephone call where I just, I guess, ask and find out a bit more about the problems that they're wanting to work on, and then I share a bit about me and my approach as a therapist, so that we can both see if we think we'd be a good fit to work together. And anyone that I speak to, I always encourage them, perhaps have a couple of conversations with a few different therapists, so that then you can find the person that you think you've got that best kind of connection with, because the therapeutic relationship that you have with your therapist is really important and key to helping us kind of work through our problems. And what else? I think there was one other thing I guess is making sure that they are accredited with whatever is their accrediting body. So for CBT therapists, you'd be looking for someone who's accredited with the BABCP, for example. And that's not to say that therapists out there who aren't accredited aren't good. You're still allowed to practice, but if it was me, I would feel more reassured knowing that's kind of the gold standard. This person's had the right training, they're having the right ongoing training, supervision, etc.
Yeah, it's just that extra layer of comfort, really, and reassurance, knowing that they've training and they need training. And I loved what you were saying about the relationship and the having that chat beforehand if possible is great, because it is so much about that, because there are so many different types of therapies, and you might not know just by reading about them if it's going to be work for you. But if you have a good relationship with a therapist, they will work in a way that works for you, and you'll figure it out together.
Yeah, exactly. And sometimes you'll get lucky with some therapists, which I generally like to try and do, is that if you have your intro call and they don't think that they'd be the best therapist for you, or they think a different type of therapy would be useful, or the same type of therapy but someone else who specializes in that area, then usually they'll try and kind of help you by giving you recommendations of, have you heard of this type of therapy? I think that would maybe be more useful for you. Or would you like me to recommend some other CBT therapists that I know specialize in that particular area, to kind of give some recommendations? Because as I said, it is overwhelming of knowing kind of what and who to pick.
Yeah, exactly. It can be a lot.
Yeah.
And do you think, in your kind of opinion, are there any conditions that really would benefit just from professional support, that really shouldn't really be thinking about the self-help route and just going straight for a professional? Is there anything that comes to mind?
Yeah, I mean, I guess any complex or serious mental health problems, usually I would say professional help. So that might be mental health problems like bipolar disorder or schizophrenia, or personality disorder, or if someone's feeling suicidal or childhood trauma. I guess some of those things, I think professional help would probably be best. And then even within the more common mental health problems, so that's depression and anxiety disorders, there are some that would be okay to start with self-help, and then there are some that, as you say, are probably best just going straight for the professional help, and that would be usually, I would say, PTSD, obsessive compulsive disorder, body dysmorphic disorder, or social anxiety. But then the other common mental health problems, depression, generalized anxiety disorder, panic disorder, those are usually fine to start with self-help. But again, it's the severity that's key in helping to determine which kind of level of intervention or care or support is most appropriate. And if you're not sure, because, why would you be sure if you're not a therapist specializing in this? Speaking to your GP, I think, is always the best course of action. Share your problems with them, and they can guide you on sort of figuring out. Or, as I mentioned, your local IAP service, again, you can always have an assessment with them, and then they can guide you and say, yeah, we think professional support, we can offer you CBT, or actually we think self-help and we can also offer you that, or just kind of signpost you to the overcoming books, for example.
Absolutely, that's really helpful, thank you. And something else I wanted to bring up is this idea of self-care, because I think it's so important for us, whether or not we're going down the self-help route or if we're working with a professional, we need to be looking after ourselves in between that work. So I'd love to hear if you've got any kind of tips for anyone watching of how they can start to prioritize themselves and prioritize self-care.
Yes, great question. We love self-care. And I think prioritizing self-care is so important for what I call mental health maintenance. So even if you're, generally feeling fine or you're not really struggling with your mental health, self-care is still really important. And I guess I think it's something that we actually should schedule into our diaries. Just like we would if we had a dentist appointment or a hair appointment, we'd put it in our diaries. And I know for the clients I see in particular, lots of perfectionists, self-care can be really difficult. And for some people, we just really struggle to prioritize ourselves. We end up prioritizing everything and everyone else. So kind of making that appointment with yourself, I think, is useful. But my 2 tips would be to try and get a balance of self-care activities. So a mix of the nice stuff, when we think of self-care, we think like having a bubble bath, doing something relaxing, but also the stuff that needs to get done, like your personal admin or cleaning your house, something like that. Because it's important to have that balance of activities that give you a sense of enjoyment, the nice stuff, but also a sense of achievement, the stuff that you need to get done, kind of that taking care of business, should we say. Because I think self-care is both of those things. So having a good balance would be one of my tips. And then my second tip would be to try and do one self-care activity per day. And even if it's tiny, even if it's like I'm going to read for 5 minutes, that's great. Because I think so often we maybe, as I said, get busy, don't prioritize it, and then we get to the weekend and we're like, right, I'm going to spend all morning doing self-care stuff, and then another week goes by and we haven't done anything. And so actually I think little and often is better than kind of one day a week or once a month or once a year, where we spend a kind of a larger amount of time on self-care. So yeah, those would be my 2 tips.
Amazing, I love that. And you're so right. I think we can kind of overblow it in our minds and think it's this big thing that we have to do, and that's why it becomes so hard to do it. But as you said, little things, and if you can bake it into your everyday routine, even better. Like I have a morning routine of listening to a meditation in bed before I even get up, and that's just baked in now. It's something I start my morning with, and little things like that can make a difference.
Definitely. And I think what you said is actually a really, really good tip of kind of incorporating it into your routine, but even better if you can kind of do something that's already there, but tweak it slightly. And that's actually something that I cover in my mindfulness course, of where sometimes there might be an activity that feels quite depleting or draining of our energy, but if we do it in a mindful way, then actually we can make it quite a nourishing activity. So like your commute, for example, if you're sitting on the train home, I remember when I used to live and work in London, I'd be like, oh, this is exhausting and just rank. There's like an armpit in my face and I'm not enjoying this. Whereas actually, if you think, okay, this is my self-care time, I'm going to sit and read for half an hour. Or like you said, do a meditation. Or if we have to walk to work, rather than walking to work, up in our heads, worrying about what we've got to get done that day, ruminating about how awful yesterday was, it's not a particularly enjoyable activity. Whereas if we go for a walk and we're doing it mindfully, looking around, taking in what we can see, what we can hear, what we can smell, etc., then it becomes quite a different activity and something that then we could think of as a form of self-care.
Amazing, I love that idea. Yeah, just subtly making little tweaks to what you're already doing and just make it a bit more nourishing. I love that.
Yeah.
Perfect.
Yeah.
So before we go, Natalie, can you share with everyone where they can find you and where they can connect with you online?
Yes. So they can head to my website, natalienglander.com, and that's got information about me, I guess, and the things that I offer, the therapy, my mindfulness course, and also supervision of other therapists as well. And then there are some resources on there. So I've got a free mindfulness guide that people can download. And I've sort of done various different podcast features talking about things like perfectionism, self-esteem that people can listen to, or different kind of articles and things that I've written. People can sign up to my fortnightly newsletter, which is not spammy, I promise. It's called Perfectly Imperfect, and it is to encourage you to be kind to yourself and to embrace your imperfections. So people can get that in their inboxes if they want to. And then I'm also on Instagram as the Perfectionism Therapist. So at the.perfectionism.therapist. And yeah, those are probably the main ways people can learn more about me and connect with me.
Perfect. Thank you so much. And thank you to everyone who's watching. We will leave details for Natalie below if you want to connect with her, as well as a link to counselling directory if you do want to learn a bit more about therapy, about self-help, and to find the right therapist for you. Thank you so much.
Thank you.